Hey everybody, my name is Emily Williams and I'm the product owner of MRI-Simmons Health Wellness Study. I'm excited to present to you our new 2025 teaser report titled Wellness in Focus: What Americans Really Think About Health. And our goal with this is to provide you with valuable insights into U.S. consumer behaviors and opinions regarding their healthcare choices, and show you how these insights can strengthen your marketing and activation efforts. A little about the study. MRI-Simmons Health and Wellness Study offers a deep dive into American adults' health habits, attitudes, and healthcare interactions. The study explores behaviors and attitudes related to health insurance, seeing a primary care provider, retail health, urgent care, telehealth, mental health and therapy, and more. The study releases annually and surveys 5,000 U.S. adults age 18 plus who are nationally representative by gender, age, race, educational level, and region. Each year, the questions are appended to the latest MRI-Simmons USA study, allowing you to cross all health behaviors and opinions with our already measured purchase behaviors and product and brand profiles by over 60,000 variables. Now that I've given you a brief intro to the study, I'm going to walk you through a few insights we pulled this year. This year, brands and agencies told us they're focused on understanding the path to prescription and how ads influence that journey. Running with this feedback, we found that the majority of U.S. adults think ads for prescription drugs do a good job of communicating the name and purpose of the drug. Over 1/3 talk to their doctor about a drug they've heard or seen advertised, and 30% are actually more likely to take a drug that is advertised. And this is especially prominent for Hispanic adults, who are 32% more likely than average to take an advertised drug. This shows that ads don't just build awareness, but they influence real health decisions. And while 1 in 3 adults find drug ads entertaining, over half of Americans support prohibiting these ads, underscoring the need for responsible messaging. Marketers for these drugs must be aware of mixed feelings and balance creativity with trust building and compliance. A certain prescription drug that is openly discussed for weight loss is semaglutide, which includes brand names Ozempic, Wegovy, Rybelsus, etc. We asked respondents if they personally know anyone taking semaglutide, and nearly 1/3 said yes. In fact, 13% said a family member is taking it, and nearly 10% said they know a friend who is taking it. So at this point, this drug isn't just a prescription, it's more of a cultural touch point. And opinions on this drug are also mixed, with nearly 50% of adults agreeing its benefits outweigh any risks, and this is up 6 points year over year, and 30% saying weight loss drugs are the best way to lose weight. This reflects a shifting cultural narrative around health, weight, and lifestyle, making it a prime area for strategic messaging. When it comes to diet, nearly 30% of U.S. adults completely agree that they look at the sugar content in the foods they eat, and 26% look at the sodium content. And with our health and wellness study being fused to our core USA study with all of our brand consumption measures, we can explore how these attitudes impact actual purchasing habits. And interestingly, food preferences among Americans who look at the sugar and sodium in their foods align with these statements. Sugar-conscious adults are more likely to buy lower sugar, higher fiber items like Nature's Own whole wheat bread and Raisin Bran. Those watching their salt intake over-index for buying no salt or low salt seasonings like Accent and Dash. Beyond limiting sugar and sodium, over half of adults completely agree that processed foods are bad for your health, and 32% are limiting their intake of them. For 14% of adults, having gluten-free options is very important, and nearly the same amount are willing to pay more for them. Knowing how different subgroups of Americans feel about their diet choices, crossed with what brands they buy, where they get their news, if they listen to podcasts or streaming music, etc., can help marketers in knowing where and when to place ads for the greatest impact. And thankfully, you can get all that with MRI-Simmons studies. A new question we added to the health and wellness study this year asked about who is the primary decision maker in healthcare decisions for the people in our lives. When looking at who respondents say they decide for in their lives, we found that over 80% of adults make their own healthcare decisions. Nearly 20% make decisions for their significant other and other kids and adults in their family, and 13% make decisions for their parents. We broke this down by generations and found that a significantly lower percentage of Gen Z make healthcare decisions for themselves at 64%, while Gen Xers are the most self-sufficient. However, millennials revealed the highest percentages among the generations to be the primary decision maker in healthcare decisions for spouses, parents, and others in their family. Breaking this down by gender and race, we see that women are more likely to be primary decision makers for their children, and Asian adults are more likely to be decision makers for their aging parents, which both align with cultural or societal norms for these subgroups. Alternatively, we found that about 15% of adults say they are not the primary decision maker in healthcare decisions for anyone, and they skew significantly for being ages 18 to 24. Knowing who is and is not the primary decision maker is critical for marketers because it shapes targeting, messaging, and media strategy. As we see, healthcare decisions often involve multiple stakeholders, from the patients themselves to caregivers, spouses, or adult children. If marketers know who actually makes the final call, they can allocate ad spend toward the right audience rather than wasting impressions on less influential groups. Our health and wellness study focuses on various aspects of overall wellness, and that extends to mental health. When exploring mental health attitudes among U.S. adults, over 90% agree that physical and mental health are equally important, they impact each other, physical activity is crucial for a healthy mind, and therapy can be beneficial. In fact, 83% of adults think anyone can benefit from therapy. When thinking about cost, 69% actually think their taxes should fund mental health programs, though 88% think insurance should fully cover the cost of mental health services. While most Americans are supportive of mental health initiatives, there are still some hesitations. Over half of adults say they'd use these services if they weren't so expensive. 2 in 5 don't have time for it, and over 1/3 fear judgment of others if they sought out this kind of help. 22% of adults even go so far as to say that seeking therapy is a form of weakness. When looking at these attitudes by the 15% of adults who report going to therapy or receiving counseling, percentages for these hesitations increase, showing that fear and shame are still tied to admitting to struggles and seeking mental health help. This is important for brands to understand as they navigate conversations around authenticity, being true to oneself, and self-care. Messaging can revolve around transparency and leaning on those around you, and even influencer partnerships can be leveraged for greater impact and normalization of the conversation. There is a lot packed into the health and wellness study and many more slides with insights in the full annual report. We dive into everything from preventative care and insurance to retail health, telehealth, alternative health, and more. The full report comes with a comprehensive slide deck that breaks down insights across every topic, making it easy to find what matters most to your brand. And we're not standing still either. Each year, we evolve the study based on feedback we receive, adding new questions, exploring emerging trends, and making sure the insights we deliver are not only high quality, but also highly actionable. With access to the Health and Wellness Study and the USA dataset, you can not only explore detailed audience behaviors and attitudes like I've shown, but also activate those audiences directly through your preferred ad tech platform and media partner. Whether you're looking to reach adults on the path to prescription, those paying more for gluten-free foods, or those with varying opinions on vaccines, MRI-Simmons gives you the tools to connect to them in meaningful ways. If you're ready to turn these findings into action, let's talk. Reach out to us at info.ms@mrisimmons.com to learn how you can access the full Health and Wellness Study, the USA Study, ACT, or any of our other powerful tools. We can't wait to hear from you.